I'm David Swartout, and I'm the office manager at Mountain View Medical Center. So overall, HealthCo is really just great to work with. The people that we deal with there, whether it's from the support team, PM or EMR, to the sales staff, it's really just a great organization. So I really think that centricity enhances the care that we give to patients. One of the goals that we have as a staff is how do we deliver the best possible care to our patients and affect community health. And I really think that centricity has helped us achieve that, through the use of protocols or through the use of just having the right systems in place to catch diseases early. One of the things that we have done recently is instituted in our protocols kind of a mammogram check for female patients. And it's been really cool to see, we started this really in April, and over the last 4 or 5 months, we've actually caught, I think we're up to 9 early breast cancers. And this is something we wouldn't have caught before. So, talk about making a difference in those 9 ladies' lives and in those families. And it's something that really is a direct response from just the system working correctly. So our experience with Easy Access Patient Portal has kind of come a long way. So we were one of the initial beta sites a little over 2 years ago as HealthCo was rolling that out. And it was good, not great. I think at the time there was lots of workflows that could have been better. And one of the things that's really cool to see from a manager's perspective is when staff would come to me with enhancement requests or, hey, how can the portal do this? Can we get from here to there? And being able to take that to HealthCo and say, hey, here's an enhancement request, what about this? And the cool part is actually seeing that in a couple weeks, there was actually a request I put a request through, and a couple weeks later, there it was. And it really made our interaction with the portal a lot better. It used to be that it was myself and one other staff member were the only people that had the knowledge to actually set up a new patient on the portal. And with enhancements, every one of my staff members, including the physicians, actually will sign a patient up on the portal, get them a password, and get them lab results kind of all in the room, all at the same time. So it really took the burden off of me to have to manage that. And our communications with patients are just better. In this age, everybody has a smartphone, and patients really appreciate just getting an email straight from the portal to their smartphone, and we don't have to call and bug them and remind them that there's an appointment, or using text message across the portal. That's really been great. We just don't do the same business we did back then. Our patient care is better. The amount of work that we're able to do and get done, it's quicker, faster, it's just more efficient. So our staffing model prior to centricity, we were obviously on paper at the time and using kind of a PM only EMR, if you could call it that, just for scheduling and billing only. We had 4 providers and 36 employees. Since moving to centricity, one of the ROIs that we kind of done early on was, hey, we don't need a bunch of staff pushing carts of charts around, and we don't have to file charts and pull charts and prep charts. And today we have 6 providers and 20 employees, and talk about the efficiency gains there of just being able to do more with less. The advice I would give to a fellow manager is this is probably the toughest transition you're ever going to make, but it's one that you do again and again and again. The pain that we went through getting all of the workflows pushed together and make sure that, electronically the same piece of paper showed up at the same desk at about the same time as it would otherwise, was really a goal of ours. And, one of the things I think made us very successful is we sat and listened to our HealthCo trainer and that implementation team, and we wrote down everything she said, and we actually did it all. Which actually caused us, our oldest provider in the office actually went live a day earlier than everyone else in the office because he was just ready. And I would say, listen to what HealthCo has to say, and they're here to help. HealthCo always cares. I think whether it's talking to support, PM or EMR, or the sales team, it's always nice to know that someone on the other side really is looking out for you.